Okay, so we're on the third video for Chapter 18, Nursing Management Early Newborn Period Nursing Interventions, number 1.
All right, so now we're going to talk about just our nursing management. So the things that we are going to do. So general nursing or general newborn care, the new parents are in the hospital for just a really short period of time. The average stay is 24 hours for a vaginal and 48 to 72 hours for a C-section. So really, it is really important that we take this time to teach the parents newborn care and to go over everything. It's important, let's see. So on the bathing of the infant, this is important that, a few things that are important on this is, first of all, when we give that first bath in the hospital, we want to make sure that their body temperature is at least 97.7 degrees. And then we check their temperature before we bring them back to mom, right? We want to warm them up again. A lot of times, a bath will be given under a warmer. So we really just want to be super aware of thermal regulation and heat loss, so we don't want them to lose too much heat. So our baths are quick, we're drying frequently, we're not leaving them with water on their skin to cool them down, and we're just doing a real quick bath and drying of them and making sure their temperature is back to normal before we let them go back to mom. There's something else I want to say about that. I think your book talks about just plain water on the face and then a mild soap on the body. The American Academy of Pediatrics recommends no lotion on the skin for the first 30 days. It's kind of like just letting that old skin slough off and letting the new skin replenish itself and go. Baby powder is never recommended on a newborn. It can be a respiratory irritant for the newborn, and it's just not necessary. When we give a bath in the hospital, we're going to wear gloves that first bath. So it has, it still has mom's fluids and blood on the baby. So we're going to wear gloves. And then after the bath, you can treat the baby just like you would an adult patient, where you wear gloves if there's open lesions or wounds, but you don't routinely wear gloves. Elimination can vary per kid. The urine is definitely a light amber color. Most newborns will have about 6 to 12 diapers in a day, wet diapers, if they have adequate hydration. And this is around a week of age. They'll start to get about 6 to 12 diapers or wet diapers a day. Stool changes rapidly in color and texture the first few days. So meconium is that first 48 hours. It's thick and dark and tarry. And then the transitional stool will be more thin. It starts to thin out. It's more brown to greenish and less sticky or tarry than meconium. This usually will happen around day 3. And then after day 3, we'll have the regular stool, which will be either a gold seedy stool, like a mustard color with seeds, if it's a breastfed, and then just kind of a greenish, yellowish greenish, pasty kind of consistency if it's bottle fed. And then the diaper care area, we just want to make sure that we are cleaning, doing regular diaper changes, that we're not letting, that ammonia from the urine can cause diaper rashes, or the stools, so we want to make sure we're doing regular diaper changes, that we're cleaning with a wipe that doesn't have alcohol in it, that it's just a regular wipe, and that we're letting the area dry. If a rash does occur, there's diaper creams that we can put on, a petroleum jelly, anything like that, to kind of be a barrier between the wet. So this is just kind of, when we go to bathe the baby, we want to make sure that the temperature is at 97.7 or 36.5. A complete sponge bath should be given within 24 hours of age. Every hospital has a different policy on this, on when they can give. Some hospitals it's 6 hours. Some hospitals they can give it that first hour. So it just depends. But really, we're just making sure that the baby's staying warm and not having a significant amount of heat loss. The bath should be given under a radiant heat source. If the temperature can't regulate, can't stay up, then we're going to postpone the bath. And we want to, there is going to be exposure to body fluids, so we should wear gloves with that first bath. Then I kind of liked this with elimination. So basically it's just saying we expect one void in the first 24 hours of life, but really they should be voiding 6 to 8 times after 24 hours of life. So we expect there should be at least a void, that we should be documenting and monitoring our urine and stools for our output. Meconium will typically go about 48 hours. And then the perineum should be kept clean and dry. We shouldn't use wipes with alcohol. And then if we need some kind of a diaper cream or whatnot, there's options, but this is only per protocol and not routine or standard. For cord care, the umbilical cord begins drying up within hours after birth, and it gets shriveled and blackened by the second or third day. Within about a week to 10 days, it will slough off, and the umbilicus just heals as.
Hold on. Not that it matters.
Not routine or standard. For cord care, the umbilical cord begins drying up within hours after birth, and it gets shriveled and blackened by the second or third day. Within about a week to 10 days, it will slough off, and the umbilicus just heals as the umbilicus heals, it will just start to slough off. We just clean it with regular water, soap and water. We used to clean it with alcohol, but the evidence showed that really wasn't reducing the risk of infection, and it wasn't helping it dry faster. So we just clean it with regular soap and water and make sure that it's dry. For circumcisions aren't regularly performed in the hospital, in Nevada anyway, so it's not something that you'll most likely see. It's typically done at the doctor's office a week or so after the baby's born. It's one of the oldest procedures ever done, but it's still quite controversial. Whether people, there's literature that says there's benefits and there's literature that says there's not benefits. So at this point, it is an elective procedure, but it is pretty routinely done. It can be performed for medical reasons, religious reasons, cultural, or even just social reasons, right? So, but it's a hot topic. People get very opinionated on if a boy should be circumcised or not. Safety, we're going to talk about this prevention of abduction in the next slide, but there's also car seat safety that we need to make sure that the parents know about. The car seat should be rear facing. They should have a 5-point restraint car seat. There should be tight-fitting straps where an adult can only fit like a finger or two beneath the child and the seat belt. Sleep promotion, we want to promote that the baby, kind of try to get them on a sleep pattern. This is, takes months to do sometimes, but we also want to make sure that mom is sleeping. When the baby sleeps, we want to make sure that the baby is put on their back to sleep, that the baby is not placed on their belly or side to go to sleep. This is important. This has been a really big indicator. So belly to sleep is a big risk factor for sudden infant death syndrome. So the back to sleep has really prevented a lot of sudden infant death syndrome. So sometimes, some, especially mothers or grandmas, will kind of scoff and be like, well, I put you to sleep on your back on your belly. And so we just try to be like, yeah, but more babies died of SIDS during that time. And this is evidence-based. And so we really promote putting the baby back to sleep. So laying them on their back. And then we would just promote bonding. We try to help the parents interact with the baby and just demonstrate appropriate bonding behaviors. Let's go back to the safety prevention of abduction. I'm going to go here, then we'll go back to the other one. But I just like this because it kind of goes over everything that we do to keep making sure that the baby is safe, right? We also have a code pink in the hospital that if the baby goes out an exit door, we put this little band on the baby. It's like a baby LoJack. Like if the baby has that band on and goes near an exit door, an alarm will sound. And or if there's a missing baby, there's a code pink, and all the doors in the hospitals are guarded to make sure to see that nobody's stealing a baby. But routinely, more commonly, what we do is we put these identification wristbands on the baby that have to be cut off. They can't be removed unless they're cut off. We collect the newborn's name. This is sometimes just baby girl and then their last name, or baby boy and their last name, their gender, their date, the time of birth, and mom's hospital number. Each time a newborn is taken, so on the units, there's a special badge. Typically might have a different color on it or anything like that. And so the mothers are educated not to let anybody take their baby unless they have this specific badge. Newborns should have an identifying band on one ankle and one wrist. The newborn's footprints and the mom's thumbprint are taken together so we can prove that that is the mom and the baby. And again, we have those badges that are required by all nurses who are caring for the baby. And the mom isn't supposed to give the newborn to anybody without a proper badge. And then most units, that labor and delivery units, have a lockdown units that they need access or permission to enter. Cord care, this is just saying the cord clamp stays in place for 24 to 48 hours. The cord will fall off within a week to 2 weeks. Only water is needed for cord cleaning. We check the cord or the stump for redness, edema, or drainage with each diaper change. The diaper should be folded down away from the umbilical stump, and we don't submerge the baby in any water until the cord has fallen off. So no baby baths, just sponge bath only until that cord has fallen off.
All right, we are done with that.